Good afternoon, and thank you for joining me today on this absolutely beautiful August afternoon as we talk about COVID-19 here in Erie County. Today we have 16 new cases of COVID-19 to report as of 12:01 a.m., which brings us to a total of 1,245 cumulative positive cases since our first case 5 months ago, in March 18th, actually. 245 of those cases are currently active. 966 have recovered, and a total of 34 deaths have now been recorded in the NEDS system. To date, we have had 20,933 negative tests. Of the cumulative cases in Erie County, 59% are female, with 41% being male. The breakdown by age is 3% from 0 to 4, 2% 5 to 9, 6% ages 10 to 18, 14% are ages 19 to 24, 38% ages 25 to 49, 19% ages 50 to 64, and 18% are individuals that are 65 or older. Regarding the percentage values, please remember that they don't always reach 100% due to rounding. Regarding race and ethnicity of our cumulative cases, 58% are white residents, 21% are African American Black residents, 7% are Asian, 2% are other, and 11% are unknown. Regarding Hispanic origin, 8% are Hispanic of any race, with 78% being non-Hispanic and 14% being unknown. And now I'd like to invite Melissa Lyon, Director of the Erie County Department of Health, to share an update directly from the Health Department. Melissa?
Thank you, County Executive. I really have a very short update this afternoon. It would be primarily in regards to influenza in the fall that will be approaching. And ideally, I would like to really reinforce and restate that we don't know what this influenza season will entail for us as a community with COVID-19 co-circulating with influenza. So it's very important that when vaccines become available for influenza, that I urge everyone that can get an influenza shot to do so. And while I'm speaking of influenza vaccines, we know that a COVID-19 vaccine is in development at the national level. And there is a place that you can register if you are interested in being considered in the early clinical trial stage of a COVID-19 vaccination process. And I will repeat the website twice so that everyone has an opportunity to write it down. It's coronaviruspreventionnetwork.org. Again, that's coronaviruspreventionnetwork.org. It takes about 5 to 10 minutes to go in. You click that you want to be a volunteer now, and it puts you into a registry. And if a clinical trial should come into our area, and if you as an individual have registered and the profile meets their expectation, I suspect that they will be contacting individuals to gauge their interest in becoming part of the clinical trial. So if that's something that you're interested in doing, I encourage you to do so. That's the only update I have today, so back to you. Thank you.
Thank you, Melissa. And on my way here to the WQLN studios, I stopped to pick up a prescription and was offered a flu shot at my pharmacy. So we were having a discussion about this morning and didn't realize that already our pharmacies have availability to give you the flu shot. And I didn't stop. I didn't have time right then to get one, but I am going to go get one very shortly here. And I encourage, just as Director Lyon did, for everyone to please go get a flu shot this year to help us fight all diseases and to help us really understand when someone has COVID-19 versus the flu. Another thing I want to talk about is that the list of the testing sites for COVID-19, those including the contact information, the hours of operation, and the ages that are permitted, was updated on the eriecountypa.gov website just this morning. So you can click on the COVID-19 banner on the front page, then click under Community Health Interest section, and there's a link there to all the testing sites in Erie County, and we try to keep that updated as those test sites sometimes do change. On another note, if you're planning to travel outside of Pennsylvania, again, we encourage you to keep up with the travel quarantine information. Currently, the Pennsylvania Department of Health recommends a 14-day quarantine upon returning from 17 different states. The list is updated frequently, so be sure to check the list often for the most up-to-date information. Again, the information can be found on the Community Health Interest page on eriecountypa.gov under Travel. And now I'd like to turn to our media for questions, and today we'll start with Erie News Now. Erie News Now, are you with us?
Yes, Kathy, it's Paul Wagner, if you can hear me.
I can, Paul. Thank you.
I wonder how the contact tracing is going. You continue to have double-digit cases every day. Can you give us an update there?
Sure. I'm going to turn that over to Melissa to give us that update.
Thank you. As of now, the reports that I'm getting internally from what we would consider our disease investigators and the contact tracing lead is we're able to manage contacting all of those individuals within a 24-hour period. So as soon as we know of a positive case, we've contacted them within 24 hours. We then get the list of their contacts. The contact tracers are then getting in touch with those individuals within 24 hours. We had a couple of days last week where at the end of the day, we will transfer that work over to the next day. And so there were a couple of days where a handful of contacts needed to be communicated with the following day. But the expectation is that we get in touch with them within 24 hours, and we're still able to meet that goal. Thank you.
Thank you, Paul. And now I'd like to go to Jet TV.
Hi, Kathy. It's Samir. This question is for Melissa Lyon. So, of course, as we just mentioned, or you just mentioned, influenza, with that just around the corner, I guess how is that going to stack up with testing? Of course, you mentioned the other day we ran a story on it that the state was kind of working on a test that could test both for COVID and influenza. Is there any worry that that's going to, I guess, back the system up with testing more than it already is?
Samir, I'm sorry. It was difficult to hear your question. I believe it was around testing, and that's about as much as I could make of that question. I'm sorry.
I think his question, Melissa.
No problem.
Can you hear me, Melissa?
I hear you okay.
Yeah, his question was around if people maybe are going in for testing because they have the flu, but they don't know it. They're being would that back up the COVID testing? I believe that was his question.
Correct.
Thank you, County Executive. So the testing for influenza and also COVID-19 is being developed, and right now they have the ability to test influenza and COVID-19 at the same time, and they just are not sure when they will prioritize that test over influenza simply or COVID-19. As well, we will still have the ability to run rapid tests at point of care for influenza. So in reality, that will take place at a point of care and should not slow down the ability to do COVID-19 testing as we are doing it currently. I hope that answers your question.
Thank you. Erie Times News.
Hi, Kathy. It's David. Based on the percentage, age group percentages you announced a little bit earlier, it seems like over the last 4 weeks or so, we've seen a pretty good increase in the percentage of 65-plus people who are testing positive for COVID. How much of a concern is that to you, and is that primarily due to the testing at the local long-term care facilities?
So, yes, David, much of that has been driven by the long-term care facility testing, and as has been reported, we've had a couple fairly significant outbreaks in our long-term care facilities, and that's always been the fear. You know, when I've talked to actually other county executives around the country early on, they said, don't let it get into your long-term care facilities. That's where it can really start to take off, and unfortunately that's happened at least twice here, 3 times, I guess, you know, that we've had some fairly high numbers in different facilities. And again, it's usually an asymptomatic person, doesn't realize that they have COVID-19. They may be wearing all their PPE, but just the amount of exposure to the patients and the frailty of many of those people makes it a very, very dangerous situation. So that really is the big driver on that.
And as far as the county and the county health department are doing, is there anything? I know the state is the one that goes in and inspects these places, but is there anything on the county level that you guys are trying to roll out to help get a handle on the number of folks 65 plus who are testing positive for COVID?
So we have a team that works with our long-term care facilities, but I'm going to have Melissa speak to anything further on that.
Thanks, County Executive and David, for the question. As far as additional parameters or programs or outreach that we're doing to for a particular age group, that has not occurred here from the county's health department perspective. However, we do have the team that works with the long-term care, and the testing around long-term care has also, if you recall, it tests the employees as well and the staff at the center or at the facility, and therefore that's increasing our numbers around, and I believe age groups as well. So I'm confident that the work being done at the facilities is appropriate. I hope that answers your question.
Thank you. Joel, are you with us from Talk Erie?
Yes, ma'am. I have a question for Melissa, and good afternoon. I wanted to refer back to the COVID-19 early warning monitoring system dashboard. We got the numbers last Friday, and I just did some analysis, and I wanted to ask you, Melissa, our incident rate per 100,000 residents is basically in the middle of most of the major cities in the Commonwealth, but our PCR positivity rate is the second highest. And so what can you derive from that, and does that indicate any kind of scarcity of testing?
So I always appreciate that you take the data very seriously and take a hard look at it before you ask the questions. I should follow your lead before I get on the conference, press conference, so that I could be better prepared for your questions. With that being said, the positivity rate is driven by the number of tests that are occurring. And so if I could channel Dr. Nadwarny for just a moment, he is our physician consultant that's been with us through the pandemic, is that what we're doing is we are testing the appropriate persons, meaning those that have symptoms, have been properly identified, and therefore our positivity rate is a bit higher. That doesn't mean we shouldn't do additional testing, but if we did more testing, you would see that percentage would then likely decrease over time, if that makes sense to you. So we're doing a very good job targeting the appropriate persons for testing.
Yeah, the entire state has a 4.0. We have a 5.9, and I guess it just kind of begs the question if this is a situation where we are really holding back, and it would be better to just encourage more people to get tests.
I think from a public health perspective across the nation, everyone would like to see expansive testing for the entire community. We know more testing identifies the asymptomatic or pre-symptomatic quicker and faster, which then we could have disease containment. So ideally what we're doing is we are holding strong with those that are symptomatic from a public health perspective. I think the pre-symptomatic or asymptomatic are likely going unnoticed and untested. And until we do have expanded testing for that, that will continue to be the case.
Thank you.
So anecdotally, just to add a little bit to that, I think other areas of the country, I've just heard from people who say they get tested quite often because maybe they have an elderly parent that they want to still see. And I don't see much of that going on here because, again, testing is limited across the whole nation. It's certainly limited in Erie County and limited in the state. And it would be great if we had, I think with some of the exciting news coming out about using not the nasal, but using your spit, I guess, to test. And there's some other exciting things coming out about testing. I hope that someday we can have much more testing here in Erie County. That is my hope. We'll go back now to Erie News Now.
Kathy, I wondered how helpful you and Melissa think this tool might be, this new app for contact tracing.
How helpful contact tracing is?
The new cell phone app that people can fairly sign up for.
The cell phone app. I'm going to have Melissa address that. We had a discussion about that earlier today. Melissa?
I like how current everyone is on their questioning. The app that the state put a press release out on earlier in the week is very beneficial for urban areas in particular, where you may have, or individuals may have been in contact with one another, but they didn't know it at the time. So mass transit is a common place where that can occur. In places where you may be waiting to get into buildings of a common workplace, along those lines. And I just learned today that it's a voluntary, and so everyone would be encouraged to use that app. And then if you become a known positive or confirmed positive, they would inquire if you are using the app. If you're using the app, then a special code is provided to that individual that would go into the app, which then triggers the notification process. I'll be honest, I don't know much more beyond what I've shared with you on how the app works. As far as beneficial, I think any way that we can be notifying individuals that they may have been exposed to COVID-19 has benefit. And then the individual becomes responsible for monitoring their symptoms, being very diligent about where they are and the types of interactions that they are having with others. So ideally, I'd like to say the more information that we can share using the technology is very important. How that's going to impact us locally here at the Erie County Department of Health and what role we will have, we're still learning those details. I hope that answered your question.
Thank you, Paul. Jet TV.
Hi, Kathy, Samir. Has there been much discussion recently with the institutions, like the Erie School District, Mill Creek, with their plans heading back? Have you guys had any discussions, about the upcoming school year?
There's been a lot of discussion. This has really taken up a lot of time on the staff, and we're glad to do that. So the school districts, and whether they're public or the parochial or private schools, we've been open and willing to work with all of them. Each of them has their own plan depending on what their school situation is. So we've been looking at their plans, giving them guidance on that. And now we have what we call strike teams going out. And those are special teams, including emergency management from that particular area of the county. And those teams go out, so it's health department officials as well as those from our public safety realm, and they go out and help the school on site. So they'll see what kind of guidelines have been put in place and in the physical buildings, and then again tweaking it, fine-tuning it, and trying to help the schools be as ready as they can be for when our students head back. I think beginning next week, some of them after that.
And then just a really quick follow-up. I know, the schools, or public schools, obviously fall under the jurisdiction of the state or the county. But what does the county recommend at this point? Are you guys comfortable, the health department and the contact tracer, are you comfortable with these students heading back? Do you recommend it, or would you rather see them institute, the online platforms for the first portion of the school year?
Again, I think every school is a bit different in terms of what they can handle, the number of students they have, the physical buildings they have, and this is a very difficult decision. It's a very difficult decision for a myriad of reasons, and I don't know that we could actually say we have a recommendation specifically. I would say generally, because again, there's a lot of variations, and I don't know if Director Lyons has anything further she wants to add to that.
I think the only thing I would add, and you have covered it, County Executive, is the idea that every school has its own flavor. Every building is very different, what resources they have available to them. So the County Health Department, along with the strike teams that were discussed, have been working very closely with the school districts. And I think they've made very wise decisions based on the information they have and the plans that they can put into place. And so some have decided to only do virtual and some have decided to do blended. And I think they've done a fantastic job processing that information and making the best decisions possible. So with that, we are supporting them in their decisions.
Thank you. Erie Times News, David?
Yes, Kathy. We've seen in recent days about outbreaks of COVID at some of the larger campuses across the country. Notre Dame, North Carolina, Michigan State. I know there's only one campus, I believe, that has classes going on right now. Has there been any new news in terms of the local campuses, and are there any steps the county can take to help these schools operate safely without any outbreaks like we've seen at some of these other campuses across the country?
So again, just like with the K through 12 system, the Department of Health staff has offered their assistance. We have conversations with these schools that are reopening to, again, assist in any way. Many of these schools have their own supports in place. For example, Penn State Barron, my understanding is the testing will be coordinated with State College campus. Of course, that's a big system, and so there's assistance being offered both ways, but we want to be there to guide them. I will say I had a great discussion and short tour at Gannon just last Friday. Of course, Gannon students are all around county buildings. You know, their campus and our campus sort of intermingle, and I've been very impressed by the percentage of students wearing masks. It's been pretty close to 100% that I've observed. As the days go on, it gets better with every day. When I was in the buildings in Gannon and seeing what they put in place, I was also impressed with that. And I think that from what I could see, Gannon was doing everything they possibly can do, knowing that, you know, people are people and you can't control every movement they make, but they're doing their best they can to really get students to follow the guidelines in terms of mask wearing, social distancing, etc. So we're going to continue to work with them, and I'm hopeful that maybe soon we can actually have representatives from those universities on this briefing with me so that we can hear from them directly and understand what their plans are as they try to keep their schools safe going forward.
And then a follow-up on a little bit different tangent. There are reports there have been very large gatherings going on the Lower East Side at night. Dozens, if not hundreds, of young people gathering. How much of a concern, obviously, some of that's a public safety concern, but how much of that is a COVID concern when such large groups of people are milling around in some of the neighborhoods in the south, the northeast part of the city? And what reports have you heard about that?
So I have heard about some gatherings, actually not only in the city but elsewhere in the county. And so anytime you get people gathering in large groups, then you're going to have obviously an increased chance of exposure to the virus and the spread, and especially if people aren't wearing masks, and especially if they're not keeping socially distanced, which I don't think many of these gatherings are. So again, just increases the chance of the virus spreading in our community, and I think it's something we should all be concerned about. And I've talked to some leadership from different entities to help us maybe navigate through this and continue to try to spread the word that this is a very concerning practice and we need to find ways to stop it. We'll go to Joel at Talk Erie.
Yes, hi. Whoever wants to take this question is. As the disease investigators do that contact tracing and do their investigation, fill out their questionnaires, is there one activity that is bubbling up from the narrative that is kind of that surefire way that COVID is spreading? Again, the older folks like to say it's the parties by the younger folks, but is it really that? Or what's the science and what's the data coming from the contact tracers saying?
Director Lyon, want to take that one?
Thank you. So I really do appreciate this question because it was something I actually was hoping I could address. I can't tell you that there is one activity that's resulting in what we would consider clusters of disease where one activity resulted in multiple positive cases. And then what we have, what we call an outbreak. An outbreak is actually related to a facility. So Clusters are sort of related to activities. Outbreaks are related to facilities. And the activities that we're seeing are just, in general, social gatherings. And that social gathering could be lots of different things. And David Bruce alluded to that can be a large party. It could be a card party, a smaller group. It can be knitting, bus trips. It tends to be social activities. And I understand, I absolutely understand. People want to get back to the things that they really enjoyed. It brings purpose to people's lives. That social interaction is important. But it's difficult to do those social interactions safely. And it just takes due diligence to continue to wear your mask. I'm not going to give you any magic bullet on how to prevent the spread. It's the same thing. Wearing the mask, staying as socially distant as you can, and good hygiene, not sharing items when you are in your social gatherings. But again, I know that we're all suffering from some COVID fatigue, and this is the result of it. So it's just social gatherings, social activities. Some of them are organized through agencies, social groups, religious groups, and then some of them are just impromptu. Birthday parties, celebration. And so if we can all just evaluate the risk and the importance of attending the event or activity, and then doing your best to put into practice the things we know that work, which is wearing your mask and staying 6 feet or greater away from each other. And it appears to be, anecdotally, if you can do those activities outside, that as well increases the safety. So indoors tends to anecdotally look like it's making the activity a bit more risky. So I know that was a lengthy answer. There's no one culprit. It's just gathering and being close. And the disease, the virus loves it when we get together and we want to socially celebrate. So thank you for giving me that moment.
Just a quick follow-up. Is there any indication that working in an essential business, I'm thinking about the cashier at the dollar store, are they at higher risk even with all the mitigation and the plexi and the masks and so on?
I can't say that one essential function or job such as cashiering has been identified as higher risk. What I can say that we see is individuals that have to work at multiple locations and work longer hours. So those that have 2 or 3 jobs to make a life-sustaining wage are at greater risk. And I think they're putting themselves at constant exposure, longer days in the hour, and longer hours in the day. And we know that if this is really dose over time, so the more dose you get, the more exposure over time, the more likely you are to fall ill to COVID-19. So I hope that helps answer your question.
Thank you very much. It does.
Paul, Erie News Now, do you have a final question for us?
Yeah, I was just wondering if you could tell us a little bit more about what these strike teams are doing with the different school districts around the county. Are they just inspecting the buildings? Are meeting with the staff? Maybe you could shed a little more light on that.
I have sort of a general overview. I don't know if Director Lyon has more specifics for you. I'll turn it over to her.
The strike teams receive the plans that the most up-to-date plan that the school district has submitted for review and comment. And if there are areas in the plan that may have been particularly concerning for one reason or another, the strike team would go there and prioritize that portion of the plan. After that, they're looking at general operations, and that can be everything from where our hand sanitizer stations placed in the building, how are students entering the building, exiting the building, what interactions are occurring. So it's almost a third-party review, and there's a bit of a checklist that says, if this isn't in place or if this is a concern, what level of risk is that? So, maybe not having plexiglass between teacher-student interactions or cashing out at the cafeteria might be a higher risk issue than, say, the number of door handles that have to be sanitized throughout a day, if that makes sense to you. So it's very open dialogue, discussion. It's not an inspection. It doesn't have this, if you don't do this, you can't open your school district or anything along those lines. We're just an additional resource, an additional set of eyes. The overall feedback we've been receiving has been exceptional. I think what happens, and we all know this, when you're that close to the plan or that close to the facility, we tend to get into the weeds and might not see all of the pieces that, we often can overlook something very simple. So our team is just finding those recommendations and providing that back to them. I hope that was helpful.
Thanks. Thank you, Melissa. And Samir, Jet TV, you have a final question?
Yeah, just one, I guess that's kind of a little off topic what we've been talking about, but the environmental team, have they been called to places like Big Bar or Coconut Joe's on the weekends or anything, I guess, with places, I guess, define the capacity regulations currently?
So the environmental team continues to respond to calls and complaints and concerns that come in to the health department, and sometimes myself I get things sent to me and I send them on to the environmental team, who does a great job following up on that. So they are continuing to respond to those type of issues when they are brought forward to the health department. And I don't know if Director Lyon wants to say anything further on that.
The only thing I would add would be when complaints come in, especially if they're after hours or over the weekend, we prioritize those complaints, and so they do reach the environmental management team in a timely fashion, which then also will often involve Pennsylvania Liquor Control Board. But interesting, sometimes the complaint is not validated because it may seem like it's a large gathering, but per the guidance, they're actually meeting the requirements. So someone may see 100 people in line to an establishment and believe that that seems to be a large gathering, and I would understand why they would believe that to be true. But then if you look at, they can operate at 75% occupancy, that 100 or 150 still is allowable. So we end up doing quite a few, sitting with the facility owners and making sure that they understand the guidance, but then verifying that they are still in compliance. And I know that's hard for the general public sometimes to understand, but we are doing our due diligence around it.
Thanks.
I guess just to follow up, do you have a specific, organization or venue that would, see the most complaints, or that you continue to see the public concerned about?
Melissa?
I don't have any one establishment that's receiving more complaints than any other. It sort of depends on who's submitting those complaints and what activities are happening. So, for example, if there's live music somewhere, that facility may have received multiple complaints over a weekend versus just a regular establishment serving a dinner on a deck.
Thank you.
Thanks. Erie Times News, David, do you have any last question?
Yes, Kathy. Looking at the cases by zip code, for many weeks we've seen the 16503 zip code have way more cases than any other zip code. It looks like other zip codes are catching up to it. It looks like the 16503 is not increasing by the dramatic numbers we saw. Other nearby ones, 16511, 16510, are catching up, which is not a good thing for them. Any theories on why that's happening? Are you hearing anything about good things that are happening in the 16503 to cause their numbers not to go up so much?
Well, I think there's certainly been a lot of education, a lot of assistance, personal protection like masks and things like that, distributed in areas that had been seeing large numbers of cases. But I think this just goes in more general to the fact that COVID-19 is everywhere in Erie County, and there's not a zip code that's left out of this. There's not a community that hasn't seen some COVID-19 activity, pretty much. So it is a community spread virus, and it doesn't matter where you live or where you work or where you grocery shop, etc. your chances of contracting the virus are still there, and as I always say, the virus is looking for its next host. So we're going to continue to see that, I think, that the virus will pop up in maybe communities where people thought that they weren't really going to be affected by it, but now that they are. And so it's just important for people to realize it doesn't matter your zip code. You need to be very, very diligent and follow the guidelines.
Thank you.
Sure. Talk Erie. Joel, do you have a last question for us?
Really quick, do you know when we might be able to get some demographic data on the 34 deaths? The state is reporting 27 of them are coming from long-term care facilities. Just, wondering about age groups, race, all that.
Yeah, I'm not really sure if that's available for us in the NED system or not, or any public system, so I'm going to turn that over to Director Lyons for that question.
Thank you. And I know that data continues to be the crux of this pandemic that seems to not be meeting the expectations of sometimes community decision makers, reporters, and for that, it's just difficult because how the data systems are designed to communicate or not communicate and how to collect that data on a timely fashion and report it out. What I could tell you is it's something that we still talk about internally. Is there a way for us to be providing a level of information that would be helpful? Right now, I can't tell you that I have a solution for that, mostly because the lag from the reporting to the data being available to local county health departments is pretty significant. So at this point, I don't even feel that I have a good grasp daily on the deaths because it goes into 2 different reporting systems. So my short answer is it's still on our radar of things to look at, but I don't have a solid answer for you moving forward.
Do you think that it'll be part of the coroner's year-end report or something like that?
Gosh, I hadn't thought much about that. I would hope that we would have some end of year report that would be beneficial, but I'm just not sure what the state will have in mind for how that data is reported collectively.
Thanks.
I will say to what you reported there, Joel, long-term care facilities, our elderly are most vulnerable, and we certainly have seen that now in Erie County, and we had very low death counts for quite a while, and as you can see, many of them, the vast majority of our deaths have come out of those facilities where our loved ones are at, and that's a tragedy, and so that's why controlling COVID-19 within the community is so important to protect them, particularly the people who work in those facilities and have to go to work every day and may not know that they're carrying the virus. So it's a very, very difficult situation. So thank you for that question. I'm going to finish up here just with a couple things. I want to remind everybody that the census still needs to be completed. To update you, we're at 71% of households, just a little over 71% in Erie County. 62% of the city's households have responded. We definitely have still a ways to go. The timeline has been condensed now. It will be over on September 30th, and we need everyone to be counted. I have heard that calling in is very, very simple, and that number is 844-330-2020. Again, 844-330-2020, and you can always go to my2020census.gov. The enumerators are out there knocking on doors. They will definitely have ID with them, and they will make themselves known that they are from the census. This should take no more than 10 minutes of your time or less, and this is what shapes our community and the funding that comes to our community for the next 10 years. So it is so important that we are counted accurately here in Erie County when it comes to funding, when it comes to our representation in college and the electoral college votes that our region has. And then finally, just to talk about our star business, we have Erie Town Place Suites on Interchange Road. They have a sign-in sheet for all their pool users. They have revamped their breakfast to provide prepackaged items with minimal contact, and they offer masks to anyone who shows up and has forgotten theirs. And lastly, I was told Dahlkemper Jewelry, and just want to say that's a very distant relative. It's not my family's business, but they have a security guard who greets shoppers, who asks them to use hand sanitizer and adjust their mask so that the security camera can see their face, and then it's a great way to adjust, check and make sure everyone is safe coming in the door. So Star businesses are all over our community. We thank our businesses for trying to do the best they can to keep their customers safe, to keep their employees safe, and to help keep our community safe. And again, it's one of the things I really have been so proud of is Erie County. Everyone's trying to do their part to keep us safe and to keep COVID-19 mitigation as low as we can keep it. So just remember, as you are going out in the next week, to always wear your mask. I got a new mask, a couple of new masks for myself just to continue to brighten up my mask world, and I ask you to do the same. Keep your mask close by and put it on when you go out of your house. Do your physical hygiene. Wash your hands 20 seconds when you have a chance to wash them, often, hopefully. And when you don't have a chance to wash your hands, have your hand sanitizer with you. I keep a little one right on my keychain so I can access it whenever I need to. Keep yourself 6 foot away from people that you don't live with, that physical distancing. Talk distantly from them and still enjoy each other's company, but keep yourself distance from them. And in the meantime, if you can, try to stay as close to your home as you can and not travel too far from the Erie County community. In the end, please stay safe and always stay calm. Thank you.